Caring for an elderly parent has rewards and challenges, as you'll see in this next story. Take a look.
This email comes to us from Jeff, who's concerned about his dad. It reads, "Dear docs, my 88-year-old dad was just diagnosed with a case of shingles on his face. What causes shingles and what's the best treatment? Are they contagious? How long do they last?" Well, shingles, we've talked about it on the show. We've all seen it. And
yeah, so
touch upon this picture in particular.
Absolutely. So shingles is actually a reactivation of the same virus that causes chickenpox. It's called varicella zoster virus. So anyone who's ever had chickenpox, what it does is it actually goes and lives in the roots of your nerves. So even though you don't really expect it to ever come back, about 30% of Americans will experience this. And what we think happens is while your immune system is functioning well, it's kind of kept in check. But when you're sick from something else or you're stressed out, or in many cases just as we get older, our cellular immunity, which keeps it under control, doesn't work as well. And so it always reactivates along one nerve root. And so that's kind of the tip-off. If you get this painful red rash with a whole bunch of blisters and it's always on one side, kind of in one area, that is often zoster or shingles. In this particular case, what's really troublesome is that this is obviously on the face, so it's very painful and crusted. But it's also one of those rarer cases, which is about 10 to 25%, that involve the eye, and that's called herpes zoster ophthalmicus. And that can cause tearing, blurred vision, a lot of pain in the eye, and actually can cause problems with the cornea, the retina, can increase pressure called glaucoma, and in very rare cases can even cause blindness. So if you ever get this and it's involving that region of your eye, which is innervated by the ophthalmic nerve, sometimes even the nasal tip, but anything around the eye, like what you saw in that picture, definitely needs to be evaluated by a doctor because you need to get on antiviral medication.
And it won't always be that obvious.
No, this I think is very sad because in a lot of older people especially, this is quite painful. And if they have some element of dementia and they can't communicate that with you or their caregiver, it gets much more advanced like this before it's caught. So
talk about one of the questions Jeff had was, is it contagious? And this is an interesting one in that regard, right?
It is, because it's contagious to anybody who hasn't had chickenpox, but you can't transmit this to someone who's had chickenpox. So I often get that question about spouses, oh, am I going to get this? No, not if they have that immunity already.
And I don't know if we're all more stressed out, but it seems like people are getting shingles at younger and younger ages. Am I wrong?
No,
or is this just an observation I'm making?
When I was backstage, I was speaking to one of the producers who's had two sisters in their 20s, 30s who've had shingles. And that's really young.
My first patient who had shingles in the ER, and I'll never forget this because this is why you have to do a really thorough exam. So I'm a young, not even a doctor yet, young medical student. I go in, I'm evaluating someone for chest pain. And it was classic cardiac chest pain when you asked questions. But my superior went in, did his evaluation, came out and said, "What did you forget to do?" And what I had forgotten to do is look at the skin. So this was not cardiac chest pain. They had chest pain because the shingles was just starting to show, but all that pain was from the shingles.
That's right.
And I had
And it was radiating pain almost?
But it was very subtle because a lot of times the pain will precede sometimes the actual rash.
The shingles outbreak actually will run along a nerve and give you a band-like pain that radiates.
Anyway, that was a lesson I learned very early in my career, and I never missed that again. But it gets back to shingles can sometimes masquerade as a lot of things early on.
And it can be some of the worst pain a patient ever experiences. I take care of some of the worst pain people experience because I take care of kidney stones. But I've had patients who've had kidney stones and shingles is worse. And the problem with a kidney stone is you can get rid of it, you can go in there and take it out if it's just too much and you can't pass it. Shingles, it's got to run its course. And it can be really devastating, really distressing for these people.
And the antivirals
and
can
to your
help.
point, yeah, antivirals really important because they're going to shut down and really decrease the course. But much more importantly, we're finding that many people will develop something called post-herpetic neuralgia, which is where even after the rash goes away, they get pain all along that same route. And we're finding that if you go on antivirals, you're a lot less likely to get that. But one thing I do want to point out about the contagiousness for many people who haven't had chickenpox is it is contagious while you have the blisters, and you're contagious to someone who hasn't had chickenpox till those blisters crust over.